Good evening. Welcome to tonight's Arapahoe County Town Hall. My name is Roger, and I'll be your moderator. Tonight, we will be talking about Arapahoe County Public Health, which will open its doors in January. You may remember that last year, Douglas and Adams counties left the current health department structure shared by the three counties. That's when Arapahoe County Public Health began the important work of building a single county structure to promote health and disease and prevent disease and injury in our community. In a few moments, we'll share details of services, locations, and more. But if you already have a question you'd like to ask, you have a few options. Let's go through those. First, if you're listening on the phone, you can press *3, and an operator will take down your information and get you in the queue. If you're watching and listening online, you can type your question into the little box under the video player. And if you're watching on Facebook, you can type a question in the comments, and we'll make sure those get in the queue as well. So now I'd like to welcome Arapahoe County Commissioner Nancy Sharp, who also serves as the chair for the Board of Health. Good evening, Commissioner.
Good evening, Roger, and welcome everyone on behalf of my fellow Board of Health members and the Arapahoe County Commissioners. I'd like to take this opportunity to thank you for joining us tonight. Launching the Arapahoe County Health Department is something we've been working on for actually well more than a year. Now we're at the point where we're counting down in weeks rather than months. We're on track to open our doors in 2023, and we'll begin serving the community right away. I want to take a minute to frame our conversation, though. Public health is critically important to our community. It's different from individual health care, though. When you visit your doctor, they're focused on treating you. Public health uses a broader brush. It concerns treating disease before it can spread into the community. Arapahoe County Public Health will do that in a number of ways, like coordinating and conducting inspections. We'll track communicable diseases like pertussis. We'll make sure that there's access to adequate nutrition, and we'll have immunizations available to people who want them. So before we delve into all of the details and you hear from our Jennifer Ludwig, and we're able to answer all of your questions, let's stop for a moment and ask our first poll question. So back to you, Roger.
Thank you, Commissioner. Here's our first poll question. It is easy to participate. All you have to do is use your telephone keypad to enter your response, or if you're online, you'll be able to answer there. Here's the question. Prior to COVID, how often had you interacted with your local health department? Press 1 if you've never interacted. Press 2 if you sometimes interact, and press 3 if you are a regular user of our health department. We'll let everyone know how you voted in just a moment, but next I'd like to toss it over to Jennifer Ludwig, the Director of Arapahoe County Public Health. Jennifer, go ahead.
Thank you, Roger, and thank you to all of you who have joined us this evening. Public health has been my life's work, and I couldn't be prouder of the services we will begin offering to you in just a few weeks. The great news is that for most of our Arapahoe County clients, you'll be able to go to the same buildings and receive the same services as you always have. There will be 4 locations in the county. We will have offices in Englewood, it's near Bellevue and Broadway, in Greenwood Village, near I-25 and Orchard, and in Aurora, we'll have 2 locations. One is near Colfax and Chambers, and the other at Hampden and Chambers. These should all be familiar to those of you who have visited us in person in the past. When you visit us at each location, you'll have access to a different set of services, which leads nicely into a discussion about our services. So first, let's talk about consumer protection. Arapahoe County Public Health will regularly inspect restaurants, child care facilities, body art facilities, public swimming pools, and septic systems. Inspections are important because they limit the spread of disease. We will also have a group of employees who track diseases. and any member of the public will be able to contact us and report concerns. We'll also have a whole team of people who are ready to respond to emergencies. Many of you on the call may remember last year when Inglewood had contamination in the water supply. If something like that were to happen, Arapahoe County Public Health will be ready to assist beginning at midnight on January 1st. But before we get into services where we'll work more closely with residents, Roger, can you give us the results to our first poll?
Of course, here it is. We asked, how often do you interact or have you interacted with your local health department prior to COVID? 67% of you said never, 29% of you said sometimes, and 4% said regularly. We'll start taking questions in just a few minutes. So to be placed in our queue, just press *3 on your phone, and you'll be connected to an operator, or enter your question below the viewer online. Jennifer, back to you.
Thank you. And appreciate those poll results. And hopefully after you hear some of our services, maybe you may realize that you have interacted with us and didn't even know it. But jumping back into the services, I want to share what you can expect when visiting one of our public health clinics. Our clinics are in place for members of our community who may not have other options or may want a different option to meet their certain health care needs. For example, we provide immunizations that are required for children by schools, and also we facilitate COVID immunizations for anyone who is interested. Our clinics also provide services for sexual health, and that's things like birth control, testing for sexually transmitted infections, and screening for cervical cancer. Arapahoe County Public Health will also have the Nurse Family Partnership Program. It's a voluntary home visitation program for women who are having their first baby. This program is amazing and has many decades of research to show that participation reduces child abuse and neglect by 48% and reduces visits to the emergency room for accidents and accidental poisonings by 56%. There will also be services for residents to help reduce spread of disease with access to clean syringes. We're also very proud to be providing WIC services, which provides supplemental food and nutrition education for income-eligible women and postpartum women and children up to the age of 5. We're already scheduling appointments for our WIC clients for next year. Over the coming months and years, Arapahoe County Public Health will continue to pursue grants that will let us provide even more services like substance use prevention and healthy aging. So I know that is a lot of information to cover all at once, and I only talked about services at a very high level. Maybe, Roger, it's a good time to take a question and give everyone a few minutes to process all that information.
Will do. Just as a reminder, to ask a question on the phone, press *3. You'll be connected to an operator who will take down some quick information and get you in the queue. That's how Belinda got in line, and you're first. Go ahead.
Yes, I just wanted you to repeat the locations of where the clinics are going to be.
Jennifer,
Thank you, Belinda. This is Jennifer, and I'm happy to repeat that. So 4 locations. Each location has a little bit different service, and all of this will become available on our website. In Inglewood, it's near Bellevue and Broadway. In Greenwood Village, we are in the Denver Tech Center off of I-25 in Orchard. And then the 2 in Aurora, the cross streets for one is at Colfax and Chambers, and the other is Hampton and Chambers. And again, we'll make all of this available on our website when it goes live.
All right. Thank you again. *3 if you'd like to ask a question. Jennifer, I think you have a few more things you want to cover. Go ahead.
Thank you, Roger. Yeah, a few more things that I just want to make sure that everybody knows that the health department will facilitate. You will be able to contact Arapahoe County Public Health for copies of birth or death certificates. we can provide copies of the certificates for any birth and death in the state. And you'll be able to request those copies in person, or you can make your request electronically through our website, 24 hours a day, 7 days a week. And with all that, I also want to talk a minute about when you can begin receiving services. So we are expecting around 140 employees who will start with us in January. We'll also have 35 temporary employees as part of our ongoing COVID response team. In the meantime, all public health services will still be provided by Tri-County Public Health Department until the end of the year. Arapahoe County Public Health will be prepared to respond to emergencies beginning at midnight on January 1st. For non-emergency services, we'll be open for business following the New Year's holiday. All of the health department staff will be meeting for the first time on the morning of January 3rd. But by that afternoon, we'll be ready to engage with you and provide services. So Roger, I'm going to turn it back to you.
All right, thank you. Let's hear another question from Mandy this time. Mandy, go ahead. You're live.
Hi, thank you, everyone. This is Mandy Ashley, resident of Arapahoe County and director of the Aurora Health Alliance. My question is there coordination happening with Adams County Health Department, especially along the Colfax corridor, so those residents can still receive kind of seamless transition and one-door policy? Thanks.
Yeah, hi Mandy. This is Nancy Sharp, and absolutely, the two health departments. Many of the folks are coming from Tri-County Health, so they're very familiar with working with across the borders for both counties, actually including Douglas County as well. But your question was about Adams. And so absolutely, we are working together. Our team is working together with them today and will continue to do that. If someone goes to Aurora, Aurora falls into both counties, goes to an Arapahoe County facility, but they live in Adams County, they will receive services there as well, and vice versa.
All right, thank you, Commissioner. Again, a reminder, if you're on the phone and would like to ask a question, press *3. If you're watching and listening online, you can type your question in the little box under the video player, and if you're participating on Facebook, you can type your question in the comments. Commissioner Jackson, it's time for you to take over and talk a little bit about costs and budget. Go ahead.
Thank you. And thanks to everybody who's with us tonight. Public health isn't cheap, and it's an investment that we are committed to making for all of our residents. So our budget for the new health department is $21.3 million, and most of that, $14.5 million, comes from grants, contracts, and fees for services. You may not know that the county has traditionally allocated a portion of its budget to public health. That allocation will increase by $778,000 from this year for a total contribution of $6 million. And by the way, I want to apologize for my voice. I've got one of those respiratory viruses that's going around. So hopefully you can understand my frog voice. Anyway, a good piece of this budget for the health department is allocated to paying salaries and benefits for employees. They are the ones out in the field meeting with WIC clients, performing inspections, and operating clinics. We've also used less than $3 million in one-time transition costs to get us up and running. We're also applying some one-time funds from the American Rescue Plan Act to help us bridge some gaps until grant revenue is secured. Now, before I turn this over to Roger for some more questions, I want to cover how you'll be able to reach Arapahoe County Public Health starting in January. So you can visit our website at www.arapahoegov.com health. There's some good information out there now, but in January you'll be able to access data, find phone numbers, and interact with your public health department in all the ways you're used to. You can follow us on Twitter and Facebook. We're under at Healthy Arapahoe. County residents can also find us on Nextdoor. If you've got a pen and pencil out there, because you can also call us at 303-795-HLTH. 303-795-HLTH. But I want to remind you one more time that Arapahoe County Public Health doesn't open its doors till January. If you call us in the meantime, we won't have the authority to help you yet. So please direct your questions to Tri-County Health Department until January. And that's all from me, Roger. Do we have some more questions?
We do, and I hope you feel better, Commissioner. We have a slew of questions, and we're going to get going on those. I was going to repeat that phone number. It's 303-795-4584 for those of you that aren't sure about HLTH. HLTH 4584. All right, let's get to some questions now, and we're going to start with Damien on the phone. Go ahead.
Yes. So, hi. My question really revolves around the pandemic and how that unfolded and how Tri-County Health came to essentially be disbanded. There were a lot of people who expressed concerns about overreach on the part of health departments across the country, and Tri-County was no exception to that. So my question is, what sorts of checks and balances are going to be placed on the health department to prevent any sort of abuse of authority and subsequently the widespread violation of guidance from the health department and widespread distrust of the health department as happened throughout the COVID pandemic?
Thank you, Damien. This is Jennifer Ludwig, and I'll start with that, and then I will turn it to Nancy Sharp if she wants to add anything about as a Board of Health member. As a public health professional, we know how the pandemic, the results of that and the trust of the community in public health departments, and that was across the nation. We absolutely know how that transpired for us in Colorado. And we are aware of the need to rebuild trust in Arapahoe County and in the state and as a public health profession in general. So that is something we have been very conscious of and thinking about as we build our health department, and as we've looked, in this past year, the process that we have gone through to look at what is it that we need to build for Arapahoe County, what is it that we need to provide for our residents, because public health serves everyone. While we have very distinct services for individuals that meet certain eligibility requirements, we do serve all people. Our job is to protect the health of the population. And so we look big picture and have been thinking about what are the things that we need to do. The Board of Health is very aware of this and very concerned that we are very transparent, that we are engaging with the community, and that we are providing sound information that makes sense and that the community will resonate and is able to follow. So the board has made it very clear that they care very much about how the health department engages with the community, listens to the community, brings community voice to the table, and is expecting that of me and of the entire health department. And so moving forward, while we hope that there's never anything like a COVID pandemic in the future, we can't say that won't ever happen or that there won't be measures that need to take place. But the board wants to look at all of the data and be able to make that decision and have that community voice represented before decisions are made for the community.
Commissioner Sharp, do you have anything else you'd like to add on that?
I really don't. Yeah, I think Jennifer covered it very well. I think the big thing for me personally, and I believe our board, is to be listening. That communication is so important, and to be very in tune with what the community concerns are, questions are, listening to them, being in the community when we have certainly something as controversial. And as Jennifer said, let's hope we don't have anything like that again, but certainly being part of the community and asking one-on-one questions and not assuming that we know how people in our community are going to feel and believe. And so I think that's really having the pulse on from many different aspects and many areas across our county is going to be really important. And so that is something that our board feels very strongly about, and we obviously are going to listen to experts, but we will debate those issues and be very transparent and discuss what we might believe based on the information provided is the best direction to go. So it's a great question. Thank you so much.
Thank you, Commissioner. Jennifer, we've got a question that came in from Mark online, and here it is. Did Tri-County issue death and birth certificates previously? I thought that only the Colorado Department of Public Health was able to issue these certificates.
Thank you, Mark, for that question. And yes, Tri-County Health Department does issue death and birth certificates. There are 2 locations right now. One, in Greenwood Village, that office that will become Arapahoe County Public Health, and then the other office is up in Adams County and Commerce City. So those are the 2 Tri-County sites, and that can also be done through the Tri-County Health Department. So if you need a birth or death certificate between now and the end of the year, you can order that from Tri-County Health Department. After the first of the year, you are able to come in and see us in Greenwood Village at I-25 in Orchard. That is our Vital Records office, or you can visit us online and order those certificates there. So thank you for that question.
All right. Let's go back to the phone and hear from Stephanie next. Go ahead.
Hello.
Hello.
Hi, Stephanie.
Yes. Hi. So I have a question, and I'm not sure if it was Nancy or Jennifer who mentioned it first, the difference between individual health versus public health. And then I do know that Jennifer touched on it again just a minute ago. I am curious, based on the first polling question, and I didn't catch the second number, but I think the third number was only 4% of the population on the phone, at least, are actively using the services from TCHD. Was that correct?
Yes.
Okay. And I don't know what the other number was for maybe occasionally using. My phone kind of blanked out a little bit. But with that in mind, I'm just curious why there are individual health services available through the public health offices and clinics, if you will, because everybody has access to the Affordable Care Act. So why are we then duplicating services through you guys versus people going to their own doctor for clinic services?
Absolutely. So I'll repeat the poll. And again, this is of the participants on the phone and those who participated in the poll, 66%, and there were 188 people who participated. 66% they've said they've never interacted, 29% sometimes, and 5% regularly. So again, that's those who are on the phone. And our services, so clinical services, when we think about our nursing services, we're not a traditional doctor's office. We don't provide acute care. You don't come in and see us if you have a cold or a broken arm. But for people who may not have access to, may not have a physician, may not have a healthcare provider, will come to us for certain appointments or services such as a women's health exam or cervical cancer, they may not have a healthcare provider. And we do also try to connect for people who are eligible, do try to help them get connected and enrolled in healthcare. But we also see people who may not want to go to their regular doctor or may not want their insurance billed for certain services that they are seeing us for. There's a lot of reasons why people will come to public health, but we serve a large population of individuals who don't have regular health care or may be in between. Maybe they're in between jobs and are needing to see a nurse practitioner for a women's health issue. So, and WIC is not duplicative of a healthcare provider. So we definitely try not to duplicate services, but public health specializes in certain areas, and that would be in sexual health and immunizations. And then we also have a large team of nurses who are doing home visits with moms of first-time babies. So there's a lot of different services that we provide that you would not get in a doctor's office. And we most definitely try, if we know that there are services available in other places and the market is saturated, we don't want to duplicate. So we do really fill a void or a gap in service, and we do it in the most cost-effective way as possible. So thank you for that question.
All right, thank you. We had a nice comment that came in from Denise. She said there are large parts of the community that do trust the health department and don't feel you overreacted during the pandemic. Thank you. Thank you, Denise, for that comment. Let's go next to Annette online or on the phone. Go ahead, Annette.
Yes, I have a question about the services for aging adults. Could you explain what type of services you offer?
Hi, Annette. This is Nancy Sharp. I'm gonna turn it over to Jennifer in a moment, but I am going to first talk about what Arapahoe County offers, and in our community resources department, and again, arapahoegov.com is a good place to get information. But we do provide a number of services for older adults, and you might look at that and see if any of those might be things that you had a question about or could be helpful to you. And but I think in terms of the health department, there's so many things. I think we've mentioned some of immunizations, communicable diseases, and those kinds of things that really cover information for a broad population, no matter how old you are. But certainly, if there are things that are helpful to older adults and encouraging older adults to participate or take advantage of a service that we have, that would certainly be something that that isn't just specific to the general population. But Jennifer, is there something that that you can think of that specifically for this age group, which is also my age group? So I'm interested in the answer as well.
Yeah, thank you very much. And this is Jennifer. We are looking at finding resources, funding, to be able to really invest and do a lot in healthy aging. So how is it, not direct services. So we currently, the Arapahoe County Public Health will not open its doors with specific services that serve the aging population, such as, matter of balance classes or things like that. But we are looking to what should we and can we be doing in public health that looks really to prevent illness and early disease as we age. And there was some work that Tri-County Health Department had started in looking at dementia and Alzheimer's, and we are hoping to be able to carry some of that forward with us. We do have some of the staff members coming to Arapahoe County Public Health do have that expertise, and we're hoping to build on that and strengthen that, but really look at it from that public health lens of how we age in the healthiest and best way possible and prolong the onset of any death or disease or illness. So we are continuing to explore that, but we don't have direct service for like a senior population other than what Nancy Sharp was mentioning about, all of our services and how they fold into, the protection for all of our people.
All right, let's go to an online question. Michelle, Michelle, this one might be something you could answer. It came in from Peter. Where is the department regarding hiring for positions in environmental health and communicable disease functions?
Absolutely, I'd be happy to answer that question. And so what we're doing right now is taking a phased approach where we're working on hiring staff. We have, as Jennifer Ludwig has mentioned, we have some excellent staff transitioning and moving into positions in Arapahoe County Public Health. And in addition to that, we will be posting positions on the Arapahoe County webpage for hiring positions. And so if there are staff who are interested applicants who have that skill set that are interested in working in Arapahoe County, they can see those openings as they come and are posted. So we are continuing to take an approach where we're training current staff who will be moving into those positions, along with hiring in new staff to fill other vacant positions.
All right. Let's go to Lori on the phone next. Go ahead.
Hi, I have a question. I came down with diabetes and several other ailments after I had COVID, and I went to Tri-County. They had some diabetes classes. I got a call even from one of the women that did the class today asking about my latest A1C figures and things like that, because they just kind of try to follow up. Is there no more Tri-County that I'll be able to go to, and or are you guys going to provide any kind of classes on diabetes and that sort of thing? And then also the one on the WIC, it's going to be available to women. What are the criteria? I'm not able to work right now. I'm about 58, so but I'm not getting any assistance or anything. But I'm just wondering, what is available through that, and then I guess that's pretty much what I can think of right now. So, yeah.
Thank you for that question. And this is Jennifer. For Arapahoe County Public Health, I'm so glad that you have been able to enroll and take the diabetes prevention program through Tri-County Health Department, and that you got a check-in today. I am glad to hear that. Arapahoe County Public Health will not continue that program. We did not, because it was offered, it grant funded. That program will be moving to the Adams County Public Health Department. But we will, before the end of the year, we will try to see if we can get you connected to other diabetes resources in the community. It is something that we will look to in the future, but as we established the new health department, it was not something that we were bringing over and going to offer at the beginning. But we will definitely see that we can get you connected to other resources for that before the end of the year, and might also be worth looking into some of the resources and services that might be able to be provided through the Arapahoe County Human Services. For WIC, the eligibility for WIC, it is very specific to women who meet certain income requirements, that are pregnant, breastfeeding, not breastfeeding, but postpartum, and for infants. So you probably would not be eligible for WIC, but I do think that there might be, if you have not already, it might be worth a call or a check on the Human Services side to see what other resources might be available to you to help you get through this time.
All right, thank you for that. Again, we have about 20 minutes left in the call. You have lots of time. Press *3 to get in the queue if you're on the phone, or submit your question online, or in the comment section on Facebook. Let's hear from Larry next. Go ahead.
Thank you. I've been listening, and Tri-County is not going to be available after the first of the year. Right now, it seems that you're changing a whole health thing around. And where I am a veteran, and I go to the VA on occasions for things I need, but I also kept my insurance with the government, so I can go to anybody I want, and the bill will be paid. This sounds like a drastic change.
Jennifer, do you want to talk about it? It is a big change, isn't it?
Yes.
It is a huge change, yes. Thank you, Larry. It is a very big change. And this was, not a decision that Arapahoe County made on its own. Tri-County Health Department was formed by Douglas, Adams, and Arapahoe counties. And the state law allows them to join and be a health district, or it also allows them to leave. And so Douglas County was the first to decide to leave the partnership, and then Adams County decided to leave the partnership, and it really left Arapahoe County with no choice but to start a single county health department. So yes, it's a huge change, a lot of work going into the dissolving of Tri-County Health Department, and a lot of work to start up the Arapahoe County Public Health. But we look forward to opening our doors in January and serving the Arapahoe County residents in the best way that we can.
All right. Again, *3 on your phone. Oh, go ahead. Someone wants to jump in.
Yeah, sorry. I just wanted to add, this is Nancy Sharp, just add to that. It's a good question, and it is unsettling, but I think that you will find that the transition between Tri-County and now Arapahoe County will be pretty seamless. And I would just recommend that you keep in touch with us, keep looking on the arapahogov.com/health. That's on the that's Arapahoe County kind of connection to the health department, even though Tri-County will still, as Jennifer said, will still be your health department until the end of the year, until the 1st of January next year. But I think you will find that and be happy with the services that will be provided through Arapahoe County Health Department. And hopefully you will find that it's a seamless transition, even though it's a difficult one. But keep in touch with us. Keep looking at arapahogov.com/health. And that will be, I think that will be really helpful to maybe answering any questions. And we'll take those questions and just make sure that, that you understand, and we can answer those questions for you and make sure that you think it is, it's going to be an easy transition, and or maybe we don't think it's going to be so easy, but it will be easier than maybe everybody thinks at this point in time. Thanks for the question.
Thank you, Commissioner. Let's hear from Albert next. Go ahead. You're live.
Hi. Hello. This is Albert. I'm looking, I guess, one for some information on what the costs to Arapahoe County are going to be for the services that are now entirely within Arapahoe County and not anything being shared across the other counties. And in line with that, wondering if there's any synergies to be had with other counties that may be less politically motivated to ostracize those that don't want to follow all the same rules that perhaps the majority of the Arapahoe County people do. Or on the other side of that, there's a whole politicalizing of health care that has come about, which doesn't make any sense for a majority of the services that are being provided, such as restaurant health inspections, databases that can be shared, technology that can be shared across all the counties. So are there any other counties that you're looking at communicating with or maybe becoming involved with in a less tight way so rules don't overlap, but some services can be shared? And likewise, if you look at our state government and some of the things that maybe these aren't county things at all, maybe they should be pushed up to the state level. So what is the department's thinking on that? And are there any plans in place or any motivation to move in those directions? Thank you.
Thank you, Albert. This is Nancy Jackson. Well, you asked a lot of questions, but they're very thoughtful, and we appreciate that. We are doing our best to be as cost-conscious and fiscally responsible as possible. We are, bringing the health department in-house so that we can use our human resources department, so that we can use our IT department. And so we are combining some of those functions in the most responsible way we can think of. We have thought about a few partnerships with other counties. We're still working on that. We're basically right now just getting up the bones of the department, if you will, and making sure that all of our essential services are up and running on January. We are having to increase our budget by a little bit, but we think we can handle that going forward. So stay tuned. We are doing our very best to make sure that we're providing the services that our residents expect, and we're also being as responsible as we possibly can with the suggestions that you make. So thank you for your comments.
Thank you,
Jennifer,
Commissioner.
I don't know if Jennifer has any other comments.
Thank you. I can add a couple more things to add to what Commissioner Jackson shared. And I will say that there are a couple of programs that we have already been asked to be a partner with Douglas County. And I know it sounds odd because they left us, but Douglas County, the Nurse Family Partnership, and the Breastfeeding Peer Counselor Program, Arapahoe County Public Health, will be serving Douglas County residents because they were not able to run that program on their own. And so we were asked by the State Health Department to do that program for Douglas County residents. We're looking at other opportunities in which there might be good alignment with next door or neighboring counties to either partner or to be the provider for that service. There's also a partnership in the metro region called the Metro Denver Partnership for Health, and that is the group of health departments along the Front Range that work together in an effort to combine data resources and build our capacity. We look at where we can do shared educational campaigns, just because people move along the Front Range. And if we had a different, say we were all wanting to do a tobacco education campaign, it wouldn't make sense to have 5 or 7 different campaigns running. Let's combine our resources, pool it together, and have one big campaign where we're hitting a larger market. So that group has been meeting for a long time and will continue to meet with instead of one health director representing Tri-County, there'll be 3 new members at that table. And so we look forward to continued opportunities to partner, maximize resources, and build capacity through partnerships.
All right, thank you. Melissa, we had a call or an online question from Denise that you might be able to answer. She asks, do you have to be a citizen, legal resident to use services?
Hi, Denise. Thanks for that question. We actually do not turn anyone away for inability to pay or residency status. We do offer low-cost and no-cost confidential services for immunizations, birth control, other services and supplies. All of it is really based on sliding scales according to income levels.
All right, thank you. And let's go back to the phone now with a question from Sharon. Sharon, go ahead.
Hello, this is Sharon. I've been listening to all the conversations that have been going on. First of all, I had an original question that did not apply to the one I'm going to address now. I'm a citizen of the Centennial, taxpayer, blah, blah, blah. And I'm not happy with the response that Nancy Sharp gave about the attendance or whatever on the elderly. She says we're trying to get around to it. Now, I found that to be very offensive. Why? Because the elderly people need just as much attention now and not later as you people have been addressing these issues. Now, I found out that I've become a senior citizen, yes, as everyone. I have been put on the shelf because of my age and because I need to find this disability things and so forth without questions. I have not had very good response from any place. I found out that being elderly and disabled, I'm getting no help. And when she said, well, we're getting around to it for senior citizens, I found that very offensive, and it upset me. Why?
Sharon, I'm going to jump in. We're getting close to the end of our time. Did you have a question? I'm sure Commissioner Sharp.
Okay, my question
did
is,
not mean
why,
any disrespect.
What are they doing for the disabled and the elderly? What kind of who do we call? Where do we go?
Melissa
she didn't address
or Jennifer?
hardly anything. She says we're getting around to it.
Sharon, we're going to get to an answer.
Yeah.
Melissa?
Sharon, I apologize. I don't remember saying getting around to it.
I heard you.
Well, I apologize for
That's
that. The Arapahoe County has, through our community resources, has a number of services for the elderly. And in terms, I asked Jennifer if she would, if I'm not familiar with all of the services that are provided to the elderly through what's currently Tri-County Health and which will be Arapahoe County Health. I didn't mean any disrespect, and I certainly appreciate. I am one of those of the elderly, not disabled, but I certainly appreciate your question, and I'm just trying to refer you to both Arapahoe County, which does have services and might be able to be helpful to you depending upon what your question and what the need is. That would be certainly a place through community resources that I would highly recommend that you contact them and see how they can be helpful to you. And then I'll refer back to Jennifer. It absolutely did not mean any disrespect at all. And we know how important in Arapahoe County the elderly are a huge part of our population and growing. And we pay a lot of attention to that through health assessments and what the needs in our community from many aspects like housing, as well as nutritional food, access to food, things like that. So, I would just encourage you to, number one, let us help you if we can through Arapahoe County Human Resources. And I'm sorry, community resources. I think I said that wrong. Community resources, and then I'll refer back to Jennifer as well.
Thank you.
Jennifer, anything else?
Yes. So I would say from the public health side, there wouldn't be anything. There's specific services that we're not offering. It is not in the realm of public health. But I would, as Nancy mentioned, the senior resources through Arapahoe County Community Resource Department does a lot of work and connections and helping people get to the services and supports that they need. So I would definitely recommend looking for the senior resources through Arapahoe County because there are a lot of things that program and that division does that public health does not do.
All right, thank you very much. Sharon, I'll also can tell you the phone number for senior resources is 303-738-8040, and you can also email them at seniorresources@arapahoegov.com. We are nearing the end of our call tonight, and sure appreciate all your great questions. I'd like to, on behalf of Commissioners Sharp and Jackson and your new Arapahoe County Public Health team, thank you for taking time out of your evening to join us. For more information, please visit arapahoegov.com/health and be sure to follow us at Healthy Arapahoe on social media. Thanks again, and have a wonderful evening.